Hello, tribers, and we are live. Please give me a thumbs up if you can see us well, if you're able to hear me well. Let me see if we are live. Yes, and we are live in Tribe. Give me a thumbs up if you can see me, if you can hear me. And if you've just joined us, let me know which city you're joining us from. All right. And without any further ado, let's start with today's session. Yes, I can see there are people joining us. Please hit the like button. Let me know that you are watching the session. Let us know which city you have joined us from. So, this is one of the most demanded sessions on Tribe, which is anxiety in children. And to talk about this topic, we have with us Dr. Amit Gupta. Dr. Amit, welcome back to this session,
Thank
another
you.
session with us.
Yeah.
So let me introduce Dr. Amit once again. Dr. Amit is a neonatologist and a pediatrician in Motherhood, Noida. He has an experience of 18 years in this field. He completed his MBBS from GSVM Medical College, Kanpur in 2001, his DMMD Pediatrics from King George Medical College, KGMC, in 2006, and Fellowship in Pediatric Critical Care IAP from Max Hospital, Saket, in 2010. Further, he went abroad to do a fellowship in newborn critical care from Canada. He is a member of the Indian Academy of Pediatrics, IAP, and the National Neonatology Forum. Some of the services provided by doctor are growth and development, including general pediatrics, balance exercises, child development disease treatment, immunization advice, immunizations, etc. He is currently heading the critical care department of pediatrics at Motherhood, Noida. Any opening thoughts for the session, doctor?
I think such a long introduction I don't want. I am just a simple doctor. So, first of all, Dr. Shweta, seriously, thank you for inviting me for this session. This is a very, very important topic like anxiety in children's. We see often parents coming up, my child is anxious, my child is having this problem, he don't want to go to school, he's feeling shy, he's having some phobia of one or the other thing. So I think in day-to-day life we are seeing anxiety quite often.
Yes.
So this will be a good platform where we can discuss, like parents can come up with problems and we can discuss those issues. And this is a good topic, good platform, and in fact, a good topic for us to learn from each other.
Yes. So, doctor, to begin with, what are some of the signs that parents should be aware of to identify that their child is going through anxiety issues?
I'm sure, Dr. Shweta, when you have been like when we go through our MBBS exam or we go through our exams, we all feel anxious. हाथ रगड़ते हैं, पसीने आने लगते हैं, palpitations होने लगता है, we feel कि कुछ खाने का मन नहीं कर रहा, बस किताबें लेके पढ़ना या इधर-उधर चीजों को avoid करना. So you see a child who is not able to concentrate, he who is having some avoiding situations, या उसको palpitations हो रहे हैं, वो ऐसी चीजें कर रहा है which is just away from abnormal. He is not eating, not playing, बहुत ज़्यादा सोच रहा है. These are some of the couple of symptoms of anxiety. Though each and every kid थोड़ा बहुत anxious होता ही है. उसको उसका किसी ने toy ले लिया, he feel anxious. उसका खाना उस बहन ने या भाई ने ले लिया, he feels anxious. So anxiety is quite normal part of life. But when it is hampering the child development, when he is hampering his nutrition, when it is hampering his daily day-to-day activities, it is hampering his development, this is when we say this child, this anxiety is causing problem for the child.
Right. Okay. So we have to watch out for the behavioral differences that
Behavioral
the child
issues,
is
you have to see the circumstances, उसके आसपास का environment. He's trying to cut off from the environment. खाना कम खा रहा है, socialize कम कर रहा है, लोगों से बात बात पे डर रहा है. ये छोटे छोटे कुछ symptoms होते हैं जिसमें से हम कहने लगते हैं now anxiety is overpowering the child and he's really having some issues with anxiety, and this is the point when the parent should intervene.
in. Right. And how can parents distinguish between normal childhood worries and more significant anxiety issues?
So this is what I'm saying. See, Dr. Shweta, there are different types of anxiety. And anxiety is where, and the anxiety, one of the type is when there is phobia of something.
Yeah.
घर पे जाता है, घर पे जाकर अंधेरे से डरता है, छोटी सी चीज, वो क्या करता है, सेपरेशन एंजाइटी, मम्मी छोड़ के चले गई, पापा छोड़ के चले गए, डे केयर, वहां पर एंशियस होता है. सो these types of small anxiety, social anxiety, जहां वो पब्लिक प्लेस में जाने से, बोलने से कतराता है, स्कूल में स्टेज में बोलने से कतराता है, या स्कूल में फ्रंट डेस्क पे बैठने से कतराता है, स्कूल की टीचर से कतराता है. सो ऑल दीज टाइप्स ऑफ एंजाइटीज आर नॉर्मल एंजाइटी. But when these types of anxiety, as I discussed earlier, these types of anxiety is overpowering the child. वो कम खाना खा रहा है, बहुत ज्यादा सोच रहा है, सोशलाइज नहीं कर रहा है, ही इज गेटिंग मोर एग्रेसिव, इस तरह की चीजें कर रहा है, मोर एग्रेसिव हो जा रहा है, अपने फ्रेंड से लड़ रहा है, अपने मम्मी पापा की बातें नहीं मान रहा है, उनको पलट के जवाब दे रहा है, छोटी छोटी चीजें जब करने लगता है, then these are the things, when these are the red flags that one should think that this is not a normal anxiety, and this is the point when one should think of intervening.
Right. And how can parents support and reassure their children when they notice these signs in them?
So always a conducive environment in the family is one of the most important thing. An open communication between the child and parents. A healthy discussion about the problem. Whenever you find that your child is anxious, I give you an example. Suppose the child is anxious कि मैं टेस्ट में फेल हो जाऊंगा, he just says कि मैं टेस्ट में फेल हो जाऊंगा और रात दिन सोच रहा है ना, here you are trying to find out what is the identity factor. आपने क्या चीज आइडेंटिफाई किया, किस वजह से बच्चा आपका एंशियस हो रहा है. So first you are very open to your child, you have an open communication, you accept that he is anxious. उसके ट्रिगर्स को बैड मत बोलो, ये मत बोलो कि तुम डर रहे हो, तुम गंदे बच्चे हो, तुम ये करते हो, ऐसे नहीं बोलना. डोंट ब्लेम इट, पिक आउट द पॉइंटर्स, सिट विद योर चाइल्ड. आप एग्जाम में कब फेल हुए, मुझे नहीं लगता आप कभी फेल हुए हो. आपके एग्जाम में कम आए, बट अगर आप थोड़ा और पढ़ोगे तो थोड़ा और अच्छे हो जाओगे. आपका टॉय इसने ले लिया है, कोई बात नहीं, आपने इसको ये टॉय दे दिया है, आप इसकी जगह दूसरे टॉय ले सकते हैं. सो व्हाट आई मीन टू से, don't blame your child that your anxiety, you are bad, you have this anxiety, you are bad. Actually try to identify the anxiety, sit down with your child, make a plan, help your child to himself that he should come up with a plan. मम्मी मैं अगर इस तरह से पढ़ूंगा तो शायद मैं अच्छा रहूंगा, उसके मुंह से निकलेगा, वो चीजें निकलेंगी, then plan it. Don't expect that anxiety will go off in one go. You have to take baby steps to remove anxiety. Again there are other things. आपको पक्का पता लग गया, now my child is conscious, calm him down, talk to him, change the place. वो पढ़ना घर पर नहीं चाह रहा है क्योंकि उसको अच्छा नहीं लग रहा है, so you can take him outside, वहां जाके पढ़ा सकते हो. he is having phobia, टीचर का फोबिया है उसको, so you can play a role model. आप एक टीचर बनकर घर पर उसका एग्जाम लेकर देखो, जस्ट प्यार से उसे समझा कर देखो, कहाँ गलत हो रहा है उसको बता कर देखो. ये छोटी छोटी चीजें हैं, वे आई मीन टू से इट्स एन ओपन कम्युनिकेशन बिटवीन यू एंड योर चाइल्ड, आइडेंटिफाइंग द ट्रिगर, taking it positively, and slowly and steadily removing it is the crux of therapy.
Great. Okay. And do you think there is any role of genetics and environment in development of this anxiety in children?
Yes, there are genes. It has been clearly shown कि जब मम्मी पापा बहुत anxious होते हैं, parental anxiety बहुत ज्यादा होती है, then kids are supposedly more anxious, है ना. But there is no single genes which has been pointed कि this gene की कोई defect होगा तो उसकी वजह से anxiety होती है. It is just an environment or genetics. मेरे पापा टाइप ए पर्सनालिटी, वो बहुत एंशियस रहते हैं, तो उनके कुछ जीन्स मेरे अंदर आ सकते हैं, मैं भी टाइप ए पर्सन हो सकता हूँ. ठीक है, टाइप ए मतलब पर्सनालिटी मेरी हाइपर वाली हो सकती है. बट ऑल दीज थिंग्स कैन बी मॉडिफाइड विद अ गुड डाइट, with a good environment, with a good social things, ठीक है ना. So all these things are modifiable if one identifies the correct trigger.
Okay, and what impact does this have on children's social and academic lives?
So if the intervention is not done at the proper time, Dr. Shweta, these children's school में लैक करने लगते हैं, अपने फ्रेंड सर्कल से झगड़ा करने लगते हैं, दे हैव प्रॉब्लम, हाइपर एक्टिव हो जाते हैं, एग्रेसिव हो जाते हैं, एंड एट टाइम्स इन यंग एज दे समहाउ दे कुछ बच्चे इसमें ड्रग्स लेने लगते हैं और डिफरेंट गलत आदतों में पड़ जाते हैं. So yes, at right point of time, you intervene, try to do it, and if you are not able to help your child, take professional help. I'm sure this will be very useful for you.
Right. Are there any relaxation techniques or activities that parents can introduce to their children to alleviate this anxiety?
Yes, there are relaxation technique, वो हम सब लोग कर सकते हैं. I get hyper, you get hyper, somehow if one get hyper, stop. अगर possible हो सके दूसरी चीज सोचना स्टार्ट कर दो. So the change of environment is the first thing that you can do. बच्चा इस एनवायरनमेंट में इस कंडीशन में अगर हाइपर हो रहा है, वेरी एंशियस हो रहा है, तो जस्ट चेंज ऑफ प्लेस. घर पे एंशियस हो रहा है, उसको थोड़ी देर के लिए पार्क लेके जाओ. वन ऑफ द थिंग. सेकेंड, बच्चे को सिखाओ. अगर बच्चा थोड़ा बड़ा है, समझ सकता है, सीख सकता है, तो जस्ट लेट हिम नो यू आर गेटिंग एंशियस. एंशियस के उसके कुछ साइंस बताओ. जब व्हेन ही इज गेटिंग टू नो कि प्रोबेबली ही इज गेटिंग एंशियस, then there are some breathing techniques where he can just take a deep breath, hold the breath, and then pass it on slowly, steadily. Deep breath and then pass it on. So डिफरेंट ब्लॉक्स हैं, डिफरेंट जगह है जहां बोलते हैं 3 बार 5 बार, मतलब एक बार से बच्चे को तैयारी कराना स्टार्ट करें. जस्ट लाइक अ डीप ब्रीदिंग एक्सरसाइज. इस तरह की चीजें ग्रेजुअली करके बच्चे को बताएं कि वो अपना ट्रिगर जब मिले, ही कैन डू जस्ट डीप ब्रीदिंग एक्सरसाइजेस. So these breathing exercises, relaxation, yoga is very good. We all know music is very good. We all can sit together. And then the most important relaxation technique is a good family time. सारा परिवार साथ बैठ के खाना खाए, just indoor कोई games खोले. These are the most important relaxation technique which we all are missing out.
Right. Okay. And how can parents create a safe environment for open communication about anxiety? This was, of course, for older kids.
No, I think Shweta, an open communication should be there at home, where it is not only for anxiety, it pertains to each and everything in life. ठीक है ना? An open communication with your child, where you are asking his problem, you are helping him out to solve the issues. You are not an authoritative child कि नहीं यही, you are not an authoritative parents कि नहीं यही करना है तो ये नहीं करना है. You are more so like a democratic parents, where you have a boundary, where you are a friend to your child, where you are trying to help them out. So where there is an open communication between a parent and a father, we are like friends to our younger kids, or an elder kid. When we become friends to our kids, there become such an open discussion. बच्चा शाई नहीं करेगा आपसे बात करने में, कोई परेशानी आपको बताने में हिचकिचाएगा नहीं. So always create a conducive environment. And see, all in सब चीजों के लिए the most important thing is to be a role model. How you are treating your family partner, your life partner, kids are actually seeing these things. ठीक है ना? You are very open with your family, you are very open with your life partner. आपके घर में झगड़े तो हर घर में होते हैं, but it is, बच्चे ये देखते हैं कि झगड़ा हुआ बट मम्मी पापा ने उसको कैसे सॉल्व किया. अल्टीमेटली झगड़ा तो हर घर में होता है, बट उसको कैसे सॉल्व किया. दे वर काम डाउन, उन्होंने घर में बैठ के बातें करी. दे पिक अप द क्लूज फ्रॉम दिस थिंग. झगड़ा हुआ, उन्होंने आराम से सॉर्ट आउट कर दिया. एट द एंड ऑफ द डे बाहर जाके सबने घूमे फिरे खाना खाया. सो एट द एंड ऑफ द डे ऑल दीज थिंग्स आर done, है ना? So
Right.
try to make an environment, such a healthy environment in the home, where you are discussing openly with your child, and child is having the liberty to come and say to you that I am having this problem. I think this is what a good family life is.
Right. And for younger kids, maybe toddlers up to 3 to 4 years of age, often we see that there is a lot of separation anxiety because they are starting school, their mothers might be starting their work again. So, in that case, how do you suggest we smoothen these transitions out? How can we sort of gradually lead our kids into these changes?
So always first thing, अचानक से कोई चीज होगी तो एंजाइटी ज्यादा होगी, है ना? So if you are planning that your child should go to day care or school, उसको पहले से बताना स्टार्ट करो. ठीक है ना? पहले से स्कूल में ले जाना स्टार्ट करो. उसका एडमिशन आज है, बट एटलीस्ट उसको स्कूल ले जाना स्टार्ट करो. वहां प्ले ग्राउंड है, प्ले ग्राउंड दिखाना स्टार्ट करो. उसे टीच एनवायरनमेंट बताना स्टार्ट करो. उसे किताबों के बारे में बताना स्टार्ट करो. उसको पढ़ाई के बारे में बताना स्टार्ट करो. ग्रेजुअली पार्क जा रहा है तो थोड़े टाइम के लिए अकेले छोड़ना स्टार्ट करो, सो दैट ही इज नाउ नॉट टोटली डिपेंडेंट ऑन यू. ग्रेजुअली चल के छोटे छोटे बेबी स्टेप्स होंगे, देन चीज ठीक होगी. वन ऑफ द वेरी इंपॉर्टेंट थिंग इज प्री स्कूल टीचर इंटरेक्शन, बच्चा पहले जाए, मम्मी पापा एक बार टीचर से मिलें, बच्चे को हेलो हाय कराएं, बच्चे को, आई एम श्योर ऑल द न्यू बॉर्न्स नर्सरी टीचर्स आर वेरी वेरी नाइस, दे एक्चुअली वांट कि बच्चा आता है तो उसके साथ कैसे इंटरेक्ट करते हैं. वंस दिस चाइल्ड गेट used to all these things, things becomes fine. ठीक है ना? So pre planning is very important to reduce this anxiety, which everyone should do.
Right. And nowadays they are taking yoga sessions also. Even for toddlers, there are a lot of
Yeah.
relaxation techniques going on along with their
Okay,
preschool
Shweta, many
activities.
of the schools have actually incorporated day nowadays in the routine. ठीक है ना? छोटे छोटे बच्चे आते हैं, they just learn it. So I am saying, ठीक है ना? Whatever they learn from us. हमें बैठ के छोटे छोटे exercises, relaxation exercises या yoga या simple exercise घर पे अगर हम ही करते हैं, बच्चे हमको देख के follow करने लगते हैं.
Yes.
You are doing some yoga, बच्चे को अपने साथ as a खेल की तरह से कराने लग जाओ. I am sure this goes a long way in life.
True. Great. Doctor, any points you think we have missed out on discussing till now?
No, I think we have talked majority of the points. ठीक है ना? So anxiety is quite common, but you being less anxious, you being practical, you being very open to your child, this makes a lot of difference. See, identify the triggers, see when it is really causing trouble to your child, do intervene at this point of time, be a family, both you and your husband both intervene in a calm and a polite way. If you feel no, you are getting exhausted, take professional help, and I'm sure things will be okay.
Okay. We have a viewer's question. Till
Yeah.
what age kids experience anxiety?
Any age, ma'am. Any age, starting from like almost 2 months till old age, anyone can fear anxiety. छोटा बच्चा एंक्शियस हो सकता है क्योंकि स्कूल जाना है. 1 साल का बच्चा एंक्शियस हो सकता है क्योंकि इसका टॉय उसके पड़ोसी ने ले लिया है. बड़ा बच्चा एंक्शियस हो सकता है बिकॉज उसे स्कूल में फोबिया है कि उसके टेस्ट आ रहे हैं. सो एंजाइटी कैन हैपन एट एनी पॉइंट ऑफ टाइम. देयर इज नो एज टू इट.
Right. Great. Thank you so much, Doctor, for taking out your precious time and sharing all this valuable information with us. Any
Thank
closing
you.
thoughts for the day?
No, I think we talked a lot. Be positive and everything will be positive. Give a conducive, good environment at your home for the child to grow, and that's it. Thank you.
Thank you. Thank you so much to all the viewers for tuning in. Stay tuned for more such interesting sessions just on Parent Tribe by SuperBottoms. For now, it's a wrap on today's session. Thank you.
Take care, Dr. Shweta. Have a great day.
You too.